Did you know that in 2020, colon cancer claimed the lives of almost 580,000 people? It's understandable that you would believe it's a big number. It's true that the third most common cause of cancer-related mortality in the US is colon cancer. Every year, about 150,000 people receive a diagnosis of this malignancy. You'll be relieved to learn that approximately 30 to 50% of cancer cases, including colon cancer, are preventable, despite the fact that this may sound frightening. The most cost-effective long-term cancer prevention technique is also prevention. Which tactics are these? Keep reading and paying attention as we go over 8 strategies to reduce your risk of colon cancer. Now let's get going. Avert alcohol. Steer clear of alcohol. Your body's defenses are weakened by alcohol, which also stops the creation of white blood cells and weakens your immune system, making you more susceptible to illnesses like colon cancer. Drinking in moderation and in excess is linked to an increased risk of colon cancer. Experts advise men to consume no more than 2 drinks of alcohol each day and women only 1. It is preferable to abstain from alcohol completely if you want to prevent colon cancer. Relax. Give up smoking. Give up smoking. The effects of smoking on your health are terrible. 15 distinct malignancies, including colon cancer, can be caused by smoking. It also raises the chance of other dangerous illnesses like heart disease, stroke, and emphysema, a lung ailment that results in dyspnea. If you're having trouble quitting, consider surrounding yourself with supportive people, switching to nicotine gum or patches, substituting exercise for smoking, or getting help from a professional. Relax. Increase the amount of calcium and vitamin D you consume. Research indicates that maintaining adequate levels of calcium and vitamin D may help lower your risk of colon cancer. Good sources of calcium include beans, greens, nuts, plant-based milk that has been fortified, low-fat dairy, and spinach. Why not also include eggs, dairy products that have been fortified, and fatty seafood like tuna and salmon? These are excellent vitamin D sources. MyKind Organics Organic Plant Calcium is a USDA-certified organic and non-GMO project-verified calcium supplement that contains no artificial binders or fillers. It can be used as a supplement to your daily diet. Easy-to-digest calcium derived from plants is combined with vegan D3 and vitamin K2 in this certified organic plant calcium mix. You can fill in the gaps with a good multivitamin, but avoid using it as a substitute for actual food or as an addition to a balanced diet. Relax. Eat less processed and red meat. Processed and red meat. For those who adore meat, this news may come as a shock, but eating a lot of red meat increases your risk of colon cancer. This entails bidding farewell to processed meats like ham, hot dogs, bacon, and sausage, as well as beef, hog, and lamb. However, compared to red meat, processed meat carries a greater danger. It's still unknown why these meats trigger colon cancer. A small number of research indicate that heme iron and high-fat diets containing red meat promote malignant growth and cell division. Fortunately, however, it appears that eating chicken does not raise the risk of colon cancer. In fact, some research even suggests that eating chicken lowers the risk of cancer. Relax. That being said, it's time to up your intake of fruits, vegetables, and whole grains. Cricket game fruits, whole grains, and vegetables. A diet rich in fruits, vegetables, and whole grains is linked to a lower risk of colon or rectal cancer. Research indicates that consuming a lot of whole grains reduces the risk by 35%. A flavonoid metabolite has been shown by researchers to have the ability to prevent colon cancer. Fruits and vegetables such as blackberries, apples, broccoli, red onions, strawberries, apricots, and red cabbage contain chemicals called flavonoids. Make a daily effort to consume 3 or more servings of whole grains. Whole grain items such as brown rice, whole wheat bread, whole grain cereals, and whole wheat pasta should be on your grocery list. Relax. Keep your weight in check. Healthy weight. People who are overweight or obese have the chance of getting various diseases in addition to colon cancer. Visceral fat adheres to your abdominal organs and is generally located around the belly. It is more harmful to health than other types of fat in the body and is frequently present in people who have a BMI of 25 to 30 or above. Obese people have a body mass index, BMI, of over 30. A high BMI raises leptin levels, which increases the risk of colon cancer. Stop. Up the amount of physical activity you do. Frequent exercise has two big benefits. It improves mental health and reduces the risk of serious diseases. Research indicates that individuals who engage in regular physical activity and exercise have a decreased risk of cancer. The relationship between physical activity and colon cancer is still unknown, despite the fact that it does lower the risk of the disease. Exercise has the potential to destroy cancer cells because it increases the circulation of natural killer cells and keeps your adrenaline flowing. Get this, too. Exercise strengthens DNA and raises antioxidant levels. It also influences metabolism and growth factors, which lowers inflammation and strengthens the immune system. Too lazy to work out? Well, exercise of any kind beats inactivity altogether. Strive for at least 30 minutes of moderate exercise. Opt for exercises like walking, cycling, dancing, swimming, or gardening. Relax. Get examined. Frequently get examined. The most effective method of preventive is to get checked for illnesses. Physicians can assist in identifying cancer's early warning signals before it worsens. By doing this, abnormal growths known as polyps, which have the potential to become cancer, are found. Thankfully, fewer Americans are losing their lives to colon cancer as a result of improved and more effective screening. It is necessary to screen around the age of 50. You are at a decreased risk and won't require another colonoscopy for 10 years if there are none or very few polyps discovered. However, if your test results indicate that you are at high risk, you should be checked every 3 years. Examine your family history because it increases your risk, particularly if a parent, sibling, or kid has colon cancer. You shouldn't be alarmed if you nonetheless develop colon cancer. To assist control it, a variety of efficient therapies are available. However, treating it successfully can be enhanced by detecting it early. Recognize symptoms such as fecal hemorrhage or blood in the stool, diarrhea, constipation, or a shift in the texture of the feces. Discomfort in your abdomen, including flatulence, pain, or cramping. Lassitude or weariness. Unexpected weight reduction, feeling that there is something in your bowels. Relax. Over time, maintaining a healthy lifestyle and scheduling routine examinations will benefit your body. Whenever you see something strange about your body, consult a physician. Are you curious to know more? Let's watch a few more videos to continue the debate. View 7 things you should know about a colonoscopy and colon health, or early warning signs of colon cancer you should not ignore. Feel free to select one, or even better, watch them both. What further measures would you take to stop colon cancer? Tell us in the comments below.